Hello everyone, good morning. In this session, we'll see guidelines related to radiology specialty. Basically, what is radiology? Logy means study of or science. Radio means radiation, right? So what is radiology? It is nothing but a study of images produced by radiation. So particularly radiology is a branch of medicine that uses imaging techniques such as X-ray, CT, MRI, ultrasound, nuclear medicine to diagnose and treat diseases. So now let's talk about the radiology coding guidelines. The codes are categorized based on these topics, that is diagnostic radiology. Code ranges from 70010 to 76499. Diagnostic ultrasound code ranges from 76506 to 76999. Radiology guidance 77001 to 77022. Breast mammography 77046 to 77067. Bone or joint studies 77071 to 77092. Radiation oncology 77261 to 77799. And finally our nuclear medicine code ranges from 78012 to 79999. So that's all about the radiology code categories. Before entering into the radiology guidelines, we should know some positions and projections related to radiology. So when coming to radiological positions, we'll be having decubitous, lateral decubitous, erect, body erect or erect position, recumbent, swimmer's position and frog position. These are some positions related to radiology, and we have to look into the projections as well. We have anterior, posterior and PA projection, that is posterior, anterior, oblique view, lateral projection, lateromedial view. Likewise, we'll be having some positions, and also we should consider some body planes, that is sagittal, frontal and transverse plane. So these are some basic things in radiology coding. And now the ICD-10 guidelines in radiology. So we have to code the confirmed diagnosis when known. Code signs and symptoms if no diagnosis available in your record. If we don't have any definitive diagnosis codes and the patient is coming for a routine radiological examination, means then we have to go with routine radiology code, that is Z01.89. For example, the patient is coming with knee pain. After taking the X-ray, the provider confirmed that there is a fracture in that location. So now we have to code the confirmed diagnosis, that is fracture. If it is not confirmed by the provider, then we should go with the knee pain. And if the patient is coming for routine radiological examination without any definitive diagnosis, means we should use Z01.89. I hope you are clear now. Supervision and interpretation, imaging guidance, contrast materials, laterality, and number of views. First, radiologic supervision and interpretation. Code from surgery section or medicine section is reported along with supervision and interpretation codes when a procedure requires radiologic guidance. This is similar to imaging guidance. When the physician provides both the surgical components and radiological components, then we can code both the codes, that is from the surgery section and the radiology section. If the surgeon is performing a surgery and the radiologist performing a radiology components, then the surgeon is going to report the surgery codes and the radiologist is going to report the supervision and interpretation codes for their services. Next is imaging guidance. While building imaging guidance codes, we need to verify whether the imaging guidance is included in the base service or not. Then we can take appropriate actions. If the imaging guidance is not included in the surgery or CPT code description, then we can code the imaging guidance separately. If it is included in the surgery, then it is not reportable separately. For example, when we consider orthosynthesis codes, that is 20610, 20611, we can see the code description as without ultrasound guidance and with ultrasound guidance. So in these cases, we should not use the code 76942 for ultrasound guidance separately. I hope you are clear with this concept now. Contrast materials. Contrast materials are nothing but a coloring agents or dye used in medical imaging. It is used to enhance the visibility of organs inside the body. It can be injected or swallowed. Contrast materials may be administered intravascularly, intraarticularly, or intrathecally. If it is administered in these categories, it is eligible for with contrast. If it is oral or rectal means, then it is not eligible for with contrast. Next, we need to verify the laterality and number of views when billing the radiology codes. Next, we'll discuss about the modifiers used in radiology. So, in radiology, we'll be using modifier 26, TC, laterality modifiers LT, RT, and 50 modifier for bilateral procedures, and modifier 76 and 77. So please check these modifiers and use appropriate modifiers when you encounter these scenarios. That's all about today's session. If you have any clarifications, please mention it in the comments. We'll review in the upcoming sessions.